Hello and welcome once again to Hude Hour right here on Hude Network. As always, we are here to do what we do, which is bring you up to speed with issues within the humanitarian and development space. We like to break down these issues. We like to proffer solutions. We like to expand on advocacy that is already on ground. And the goal of it at the end of the day is sustainable development. We want to ensure that at the end of the day, we see growth, we see sustainable development across board. Today, we're still doing that as we've always done. My name is Amadin Ogbewe.
And I am Joan. Thank you so much for joining us once again. You're welcome. Hi, Amadin.
Hello, Joan.
How are you doing today?
I'm fine. I'm doing well. It's an interesting Wednesday morning today. Yeah. You know, the rainy season is here for those of us who live in the, this part of the world, closer to the equator. Yeah. You know, and it comes with all of those things, some of the sights, some of the smells, some of the fruits, which I know you have issue with some of them. But anyway, I think things are going pretty well. How are you seeing this time of the year?
Well, I'm so excited because the rainy season is when women glow so effortlessly.
But you've been glowing
yeah,
across the year.
But, dry season, there's a saying that whenever you want to get married, you get married during the dry season, or you choose a wife during the dry season, because at that moment you get to know if she can take care of herself. Okay,
I'll take that note. I'll definitely take that note. Well, today we are talking about something a bit more serious and a bit more dire. We're talking about how the issue of HIV/AIDS prevention, treatment, and we will be breaking down that issue today, shining a light on it, bringing solutions, and seeing what the progress is as of today. Now, HIV/AIDS remains one of the most pressing public health challenges affecting millions of lives worldwide. HIV attacks body's immune system, and if left untreated, it can progress to AIDS, the most advanced stage of the infection.
The virus weakens the body's defenses by targeting white blood cells, making individuals more vulnerable to infections, tuberculosis, and certain cancers. However, HIV is preventable and manageable with antiretroviral therapy, which helps people live longer and healthier lives.
It's amazing, really, the power of science. But today we'll be exploring the realities of HIV/AIDS, how it spreads, the progress made in treatment and prevention, and the ongoing fight to ensure that no one is left behind in the battle against this disease. But first, let's take a look at our headlines. Now we have in our first news for the day, we have researchers secure $1.3 million grants for HIV self-test technology. In other news, report says cases in South Africa reach 8 million. And finally, we have HIV conference showcases breakthroughs. We'll go on the break now. When we return, we will delve into these news items, and also we'll give you a background of this disease and what we can do about it. Don't go anywhere. We'll be right back. Welcome back. Now, across the world, HIV continues to affect millions, with an estimated 39.9 million people living with the virus at the end of 2023. The burden remains highest in the WHO African region, home to 65% of all cases.
That's quite a large number there. While significant progress has been made in treatment and prevention, challenges persist. In 2023 alone, approximately 1.3 million people acquired HIV and 630,000 died from HIV-related causes. Despite the availability of life-saving antiretroviral therapy, global targets for testing, treatment, and virus suppression have yet to be fully met.
And the global goal is to end the HIV epidemic by 2030, with the aim that by 2025, that is 95% of people living with HIV know their status, 95% of them receive treatment, and 95% achieve virus suppression. In 2023, this figure stood at 86%, 77%, and 72% respectively. We'll examine the progress and the remaining gaps and what it will take to achieve this goal. Don't go anywhere. Stay with us. Welcome back. Now to our first news item. Florida Atlantic University researchers have received a $1.3 million grant from the National Institutes of Health to develop an affordable, rapid self-testing technology for early HIV detection and monitoring viral rebound in patients on antiretroviral therapy. With nearly 40 million people living with HIV globally and about 630,000 AIDS-related deaths recorded in 2023, effective diagnostic tools remain a critical challenge. Current tests are costly, require laboratory infrastructure, and fail to detect HIV in its acute phase of viral rebound in treated patients. The FAU team, leveraging microchip technology, aims to develop a battery-powered capable of detecting HIV within 40 minutes using a simple blood sample. Unlike existing tests, the new technology is expected to cost less than $5 per test, making it accessible for self-testing, especially in low-resource settings. FAU's research team, led by Dr. Wasim Asghar and Dr. Massimo Caputi, believe the innovation could significantly reduce transmission rates and improve early treatment outcomes, addressing a major gap in global HIV management. And I think what's really interesting here is, first of all, whenever I hear about goals to make something more affordable, is always commendable, because this is science, but at the end of the day, these are usually done by, although this is particularly a university, but we understand that a lot of pharmaceutical developments we see can go back to, trying to make a profit. So when people have in mind that we want to make this affordable, I like to hear that. And, this test could also help with the issue of privacy and stigma. Sometimes people are just too scared to go out. You feel something could be wrong, or you feel you need to get something tested, but you're perhaps even just the doctor who's going to give you that result, or the lab technician, whoever, is what you are scared of. They're going to know, stuff like that. Yeah. So these options help people begin the journey to helping themselves, treatment and all of that. And again, I commend the issue of availability, and we need to see more of these fundings happening for scientific approaches, because science is doing a whole lot to help us.
Yes, in the angle of testing on time, like detecting the HIV on time, is very, very important, because you having HIV, or someone being diagnosed of HIV and doesn't know that he or she has HIV, it's a very serious issue. So when there is an early detection, there is an early treatment, a fast treatment, and a fast management that can take place. So I think that's very, very important. And for the aspect of the $5 for the test, it's very, very good as well. Let's move to the next news item we have. New estimates from the Thembisa model reveal that the number of people living with HIV in South Africa has surpassed 8 million, accounting for 12.8% of the population. While the rise is attributed to more new infections than HIV-related death, it also reflects the success of antiretroviral therapy in prolonging lives. In 2023 and 2024, there were approximately 178,000 new HIV infections, while 105,000 people with HIV passed away. Of those, 53,000 deaths were HIV-related. Despite these numbers, treatment coverage has reached 78%, with around 6.2 million people receiving antiretroviral therapy. South Africa continues to make progress toward the UNAIDS 95 cube target, with 95% of people living with HIV knowing their status, 81.5% of them on treatment, and 92% of those on treatment achieving viral suppression. However, many still start treatment late, with around 54,000 adults initiating therapy with severely weakened immune systems in 2023 and 2024. Another concern is the number of people dropping out of care and later resuming treatment. An estimated 714,000 individuals restarted antiretroviral therapy after stopping for at least a month, with nearly half having dangerously low CD4 counts. Despite these challenges, life expectancy in South Africa continues to rise, highlighting the long-term impact of expanded HIV treatment efforts. Well, it's what we're really talking about here. South Africa is on the rise of having people who are affected with the HIV. And there's something that really caught my attention is that people begin treatments and on the long run, they stop the treatment. Maybe, I don't know, maybe because of fear or I don't really know. We'll tend to find out what's the hesitancy or what's impeding them to finish up or continue their treatment.
Because and they do return.
Yeah, of course. So it's very important that people understand that, yes, you have been diagnosed and you have to focus on your treatment and don't take it haphazardly, and making sure that it's very important that the prevention and management needs to come from the treatment that comes with it.
Indeed, and I think that story, for some persons, might seem deceptive, perhaps, but the truth is, it's actually still more positive than it is negative, because the only reason there's an increase is that there are less HIV-related deaths than people who are getting HIV, not particularly because maybe the numbers are so overblown and all of that. But even with all of this, it clearly says that even there's a large percentage of them have been covered or are taking treatment. So at the end of the day, it's actually still positive news. And when you have less HIV-related deaths, it's actually you saying that, well, people are actually living longer, in a manner of speaking. So overall, it's a call to people to understand that, more people just need to get tested and get treatment. It's not, this is 2025. HIV is no longer an issue where it's a death sentence. You can live a healthy, full life, even go on to have children. But I believe our doctor later will enlighten us more on that. So we'll go on a break now. When we return, we'll delve into our final news item of the day before we go ahead and come in with our guests. Don't go anywhere. We'll be right back. All right, for our final news item of the day, at the annual conference on retroviruses and opportunistic infections, researchers presented groundbreaking advancements in HIV prevention and treatment. A new study on the drug lenacapavir revealed that a single injection could protect against HIV for a full year, improving on current PrEP options that require daily dosing. Scientists also shared promising findings on broadly neutralizing antibodies, which helped some people suppress HIV without antiretroviral therapy. In one study, 75% of participants receiving BNABs, that is the broadly neutralizing antibodies, maintained viral suppression 20 weeks after stopping ART, compared to those which is just 8.8% of the placebo group. And another trial in Africa showed that 4 women remained HIV-free 55 weeks after stopping treatment, with one maintaining control for 2.5 years. Researchers believe these developments could pave the way for long-term HIV management strategies and bring the world closer to a functional cure. Further studies will explore why some individuals respond better to these therapies and how to enhance immune responses to achieve lasting viral suppression. Again, I'm amazed at what science has done. As a people, as a species. I know we've got some things not too well and some things wrong, but we have, to an extent, done really well on the advancements we've made. And I think we're seeing, I want to call them our gallant scientists, still making strides. Now you see this other technique or treatment where even the ARVs are not being used. Some special antibodies are being used, and we're seeing cases where even in Africa here, people are going long spells without the regular treatment. Again, this is all clinical and trials are still being done. But again, just like the first news item we had, I do hope more is pumped into these, more support in any way possible, and we can get the academia to join in more. It's not always just pharmaceuticals. We have a lot of talent in universities, and the way it has always been is that universities actually play quite a large role, especially in the developed nations. Hopefully we can expand on this in the developing nations as well.
I must say kudos to technology and what people are doing with it. And I see it as a solution providing kind of step. So it's very important that we need to understand that people need help. A lot of things need solutions, and that's exactly what technology people or gurus,
scientists.
exactly, the scientists are doing. And also, I want to look forward. I really want to know how other individuals will respond to therapy just like others, because we read that some of them has responded while some are still undergoing the management process. So I want to get to a place or a particular phase where HIV will be eradicated if possible, and a permanent cure will be brought to the table.
Indeed, we're still cheering all our scientists here and hoping they get it right. But that's how we end this segment. We'll go on a quick break now, and when we return, we will be joined by a guest to do justice to the matter. He is a doctor, a medical doctor. He's also the GMD. I'm talking about the person of Dr. Segun Akindokun. He is joining us to do justice to this issue of HIV/AIDS prevention, cure, and control. Don't go anywhere. We'll be right back. Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. We dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people. And let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in, and let's drive straight into the heart of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
Welcome back. If you're just joining us, this is still Hude Hour right here on Hude Network. We are talking about the issue of HIV/AIDS, prevention, cure, control, and possible cure actually. And we've been joined now by an expert on the matter. He is a medical doctor, and he's also the Chief Medical Director of Everright Diagnostic and Laboratory Services, talking about the person of Dr. Segun Akindokun. Welcome, sir. Good morning.
Doctor.
Thank you.
Good to have you.
Thank you, sir.
Thank you. All right. We are on the matter of HIV/AIDS here, trying to raise awareness and answer some pertinent questions. So, if we can have a very brief, I know a lot of people think they know what HIV/AIDS is, because there's a general perception, sometimes even misconceptions. But if we can have a very quick one on that base ground of what it is, and then we can delve into current realities, projections, and all of that.
Oh, thank you very much. And what's the meaning of HIV to start with? That's the human immunodeficiency virus. This was first discovered in 1959, and it was discovered that it originated among chimpanzees. And this animal, by the virtue of the hunting system of Africans, we believe from the hunting system, the virus entered into a human system. And the first person that was discovered as having HIV was in 1981 at Kinshasa, that's the Republic of Congo. That was the first person they diagnosed of having HIV. And 3 years later, 1983, it was discovered that, HIV can progress to AIDS, which is acquired immunodeficiency syndrome. So it's the progression of HIV that leads to AIDS. And the pathophysiology of HIV is that when HIV enters the human system, it goes to attack the powerhouse, that is immune system of individual. And the particular cells that is in charge of immunity in the body, we call it CD24 plus T cells or HEPA T cells. So these HEPA T cells boost immunity of individual to fight any unknown disease in the body. So HIV virus will go and attack these cells. So the more HIV attack these cells, it causes the breaking down of these cells, which we call HEPA T cells. And with these cells, once these cells is reduced in the body, then the body is prone to unnecessary infections. As we are living, we have a lot of microbes on our body, in our saliva, in our anus, that are there as normal flora, normal organisms. Because our immunity is strong, so these organisms are just living, they will not cause any harm. But in HIV-infected individual, the cells that will fight those organisms not to cause harm, that is what HIV will attack and deplete it. Not only that, the HIV will go and hide in another cells, which we call a reservoir. And this reservoir, that is where HIV will hide and will continue to proliferate. The first thing it will do that it will convert its own DNA to that of human being, so that the body will see it as a normal cells. And as the normal cell is progressing, is producing, it will be producing another HIV virus in the body, and will keep on multiplying. And one of the things that make it difficult in treatment is that the drugs that are available to fight HIV, they usually attack the viruses in the blood. But where the HIV is hiding in the body, those drugs don't have capacity to go there to attack it. And that is what has been in the research pipeline all this year. That what are the things to do to go and attack the HIV in the reserved area in the body?
All right, I just want to clarify something. Does this have anything to do with what we hear about people having HIV for years and not, knowing that they do? Because people believe that once it starts, you get treated, you get tested, and But we've also heard, maybe you can help us debunk that a person can go for years living a regular life and having HIV without, there are no ARVs or anything, they're just not aware. Is it because of these reservoir, as you've termed them?
No. Somebody can have HIV and not knowing for a short while. Once the immunity of the individual has not been broken down by the virus, the person will still be living normal life. Whereas HIV is attacking the immune system, the HEPA T cells, then the immunity will be going down. And as I've told you, the normal organisms in our body will now start attacking the body. An individual will come down with a lot of infections, starting from the mouth, from the skin, from private parts, and so on, like that. So somebody that has very good, strong immunity can have HIV virus in the body for a little while, and the person will not know. And that is one of the things that WHO is working against, that before year 2030, we want to achieve 3 groups of individuals. That the people that are going to be tested, that they know HIV, they want to have 95% of that people that they will be tested and know that they have HIV. We want to have 95% of such people, because people are walking on the street, they don't know they have the HIV.
Yes.
Because their immunity is still strong, so the immunity has not been depleted to the extent of causing symptoms in their body. So that is the first thing. Then the second one they want to achieve is that to have 95% of people diagnosed, that they know they have HIV, to be on therapy, to be on ART therapy. Then to have the third set of people, that to have 95% of people that are on therapy to have suppressed viral loads in the body. The aim is to have suppressed viral load in the body. Once you have suppressed undetectable viral in the blood, the person cannot transmit to another person at that state.
All right, Dr. Segun, you've really, really exposed a lot, and I must say that our audience are thrilled and they must have gotten a lot of information. But I would like to ask you, let's come in the aspect of prevention of HIV, and how are those long-acting treatments and injectable PrEP used in preventing HIV in the global aspect? I want to get your global aspect.
Thank you very much. Once individual is infected with HIV virus, there are different modalities of treating, and also to make sure that individual didn't transmit it to another person. So one of the preventive way is to give medications that will allow individual to adhere to treatment that will be convenient for individual. So the long-acting injectables are now developed these days, so that it can be given to individuals that are prone to HIV infections, like those that are doing the homosexual, those that are working where they can be exposed to another person's body fluid. So, and those that are maybe there's tendency for them to be having repeated blood transfusion, such individuals, they can take this injectable, long-acting injectable, to prevent them from having the HIV. Or individuals that have been exposed to unprotected sex in the last 6 months, they have higher risk of having HIV. So how do we prevent such individuals? So they subject them to the long-acting injectable, where they can take that injections. The one they can take once in every 2 months. In fact, the research is going for that. You can have the one they can take once in 6 months. But presently, the one that is available, the one they can take once in a month or once in 2 months, that can help to prevent the HIV for developing in the individual, one, and also for transmitting to another person. And also, if somebody is accidentally exposed to an unsterilized blood or body fluid, or maybe you're a medical practitioner, you are working, you have a needle prick, you are attending to a patient, you have a needle prick, then there's available drugs to take, which cause the post-exposure medication that you must take within 72 hours of exposure to such body fluid. You must take it for every day for about 28 days to prevent individuals to develop HIVs. And other things about preventions apart from the medication is awareness. More educations about this. Oh, what HIV is all about, what individuals need to do to stay safe. As I've said, once somebody is having HIV, it doesn't mean that is the end of the road for individual. So you take medications that will make the HIV virus to be suppressed in the body. Therefore, you can meet your partner and you won't transfer to your partner. You can also give birth to a child. The child will not have the infection. So that is the aim of the treatment, which is in line with prevention for others to get be infected with virus.
All right, that's an interesting and I think a good one for those who can access it, which takes me to my next question. What would you say are those barriers that are hindering equal care when it comes to HIV treatment globally?
Yeah, thank you very much. And it has been shown that the people that live in the low socioeconomic region, they are prone to HIV virus. And when I'm talking about the low socioeconomic region, apart from the regional part of the continent, Africa, Asia, Middle East, and co, even the developed world, we have some suburb area that the people are subjected to poverty. So low socioeconomic factor, poverty, and poor accessibility to the healthcare facility.
Thank you so much. I would like to ask you, how is the integration of HIV care with broader healthcare services, systems rather, adapted with COVID-19 disruptions worldwide?
Thank you very much. During COVID-19, we all know there is a lot of lockdown or total lockdown in some countries, in some areas. So preventing people to have access to the usual treatments. And those that are on heart antiretroviral therapy, this tablet, they take it every day. And for proper follow-up, they usually give to these clients or these patients at short appointments, come to the physician, be sure they are taking this medication. This period of lockdown of COVID-19, some couldn't have access to see their physician, and the medication they have at home has been exhausted. So therefore, we have a lot of cases that have progressed from healthy individual to even AIDS during this period. And this really affected the projection of WHO that before year 2030, we should be able to achieve 95, 95, 95 reduction, just as I've explained earlier. So it affected that projections. This COVID-19 affected them, and it now makes the medical facility, the medical field to think that, oh, let's do other things, that if people can even come out to access this, they can take this medication, the injectable, and they will stay off hospital for a longer period. So that is how the world, the health care system were able to surmount this problem. But there was this problem during the COVID-19. Right. The people deteriorated because they couldn't have access to the care.
So let's move on now to promising trends. You've already indicated the drug having that 6 months gap instead of the current 2 months. What are the other things that we can look forward to? Because every other day, I think some headlines pop out that somebody somewhere is working on a cure and so on and so forth. Are there any promising developments, research, clinical trials are on the way that could disrupt, the HIV system and everything? Just like COVID-19 came and we're all shocked when, I think it was a couple of months or weeks, and then we saw a vaccine. Yeah. So is there any progress on the front for HIV?
And thank you very much. There is a lot of research that has been going. Research has been ongoing for the past 40 years, and to really find out how to cure HIV. The mechanism that HIV uses in the body, it makes it to be difficult to cure. Because once it's entered into the system, it attacks that HEPA T cells that boost immunity of an individual. And it makes sure it's deteriorating, is causing the breaking down of that immunity, or the individual come down with infection and diseases. Now, the HIV, not only that one, it will go into the cells of the body and change its own system to the body system. As the cells of the body is producing, as the individual is growing, developing, the HIV is also multiplying in the system. So the medications that came in the initial stage are the medications to attack the HIV in the blood. But where the HIV is hiding in the body that is manufacturing itself, the medication couldn't get there. And this is what led to the research in the medical field. What can we do to go there? And I will digress a bit. The normal vaccines for different diseases and infections is usually use that organism, we make that organism impotent, and will be introduced into the body of an individual to generate antibodies to fight that disease. That is mode of generating the vaccines. You make that organism to be impotent and introduce it to the body of individual. But HIV virus, we cannot be tested that you can make it impotent and it will not activate itself in the body of an individual. So it makes vaccines a bit difficult to get. However, other means that the researchers have developed is to make use of gene. That's what we call a deleting gene system, CBT 101, that has been, in fact, they started testing it since 2023 to see that if this can work in the body, that it will go to the hidden place of the HIV and control the DNA, so that the DNA that the HIV has generated can be destroyed from that level. So this research is ongoing. It was even presented in the World AIDS Day, WHO Day last year, and the research has gone further that this can be useful, but it's yet to be concluded. So that is the latest trend that is going on. The other medications, like the long-acting injectables, they are also being used to attack the HIV viruses at different levels where they are being attached to, so that it can help to produce cure as soon as possible.
All right.
Thank you.
Thank you. Let's talk about stigma. We know that stigma is one particular thing that is associated with HIV. A patient being diagnosed, the whole community begins to stay away from the person and all that. Let's talk about the international scene now. What's the stigma rate like, and what are those steps or strategies that should be taken to combat such stigma?
Oh, thank you very much. And initially, when the HIV was detected and in the whole world, once anybody is tested HIV, it's like the person received death sentence. But it's not like that again. It has been shown that the HIV is a chronic disease, a chronic infection to be managed, not a death sentence. How do I mean? There are different ways of treating it. Individual with HIV can live as long as the individual wants to live. Once individual can just follow the treatment plan, and that's all. So the only thing that makes individuals to come down with AIDS and die is failure to follow the treatment plan. Now, there are two modes of stigma that has been developed. We have internal stigma and external stigma. Individual will believe that, oh, if I go for testing and say, oh, I'm positive, oh, I'm able to get a job, I'm able to do this, people will look at me, I'm able to fit in the society. The internal stigma is there for individual. Then the external stigma that people know, oh, this one is HIV positive, people will be looking at it. Now, globally, one of the things they develop is that you don't say somebody is HIV positive. You say people living with HIV. That is the first thing to combat the general stigma. You don't say this person is HIV positive. No, the people living with HIV. So that is the accommodating way of presenting it. So which is of a great value to douse the stigma that's been attributed to it. And not only that, the repeated educations of general populace worldwide that, oh, there are treatments for this, you can live fine. In fact, you can live so better than another person that didn't have HIV once you follow the treatment plan. Because the aim is to make the HIV not to be detectable in the body, in the blood. That is the treatment aim. And once you can take your medications, you can go and do the HIV test and it will be negative because you are regular on the medications. So it has detectable level. So what are we now talking about? You can do any job any other person is doing. So that helps to reduce the stigma. And this information is available and people are being educated about this every day.
I would like to, I want to chip in something. There are individuals as well that maybe on the long run, when they've started taking the medication, and on the long run, they become, they start having fatigue. They don't want to take it anymore. You know, some of them stop 1 month, 2 months, because you said that if the individual follow the process, it can be suppressed. So what is your opinion, or what's your advice to those patients that they've started the journey actually, but on the long run, they became tired on it and decided to just drop it?
Yeah, well, my advice generally is that so far we have medication to suppress this virus in the body. They should keep on following these other laid down rules of medication. And for those that are able to afford the injectable one, once they take the injectable one, it reduces the daily medications. You take the injectable ones, you can take that can last for 8 weeks. That is 2 months. So as soon as you can afford it, that is good. It reduces the stress of taking medications every day. Your children, you are protecting them, because by the time you take these medications and you have undetectable virus in your body, then you cannot transmit it to your partner, and anybody around you cannot be infected with it. And that is the aim, that you have undetectable level of the viral load in the body, then you are free, you're going to live long. And because of the research that is still ongoing, other things are still coming up that will make life on medications. Just keep on with these medications. Don't live long as you want to live long. So take it serious and don't be weary of taking the medication. As I've said, in the facility you are using, if there's availability of the long-acting injectable, key into that. It helps you from having this unnecessary stress of daily medication. Thank you.
Indeed. Thank you so much for that, Doc. What you just said reminded me of a disease. The name slips my mind now, but I understand that it causes sort of is it mucus and stuff to build up in the body, and there were a bunch of people who didn't live long, or it was like a death sentence for them, and then a drug came and their lives changed. And we saw testimonies from people saying, I spent all of my life preparing to die. Now I'm preparing on how to live. So I think that's one of the things about science, and how keeping with the treatment, like you said, you never know what could happen. Some of these things could pan out and it could turn around. So just around, this HIV awareness and understanding from the bottom level up.
Yeah, thank you very much. Let me just say this fact emphatically, that HIV, it will not be shown on the face of the individual. Therefore, you must prevent yourself. You must tell the young ones, you must tell everyone out there that we must practice safe sex. Safe sex, make use of barrier method, make use of condom. As a man, as a guy, as a lady, as a woman, you have the condom of your own size. Make use of that always. And also avoid unnecessary exposure to others' body fluid, the blood of another person. Avoid exposure to that. Protect yourself always. And if you have been diagnosed of having the HIV in your system, that is not the end of the road. Make sure you take your medications, which will help you to prevent the transmission to your loved ones. It will help you to prevent the transmission to your loved ones by taking your medication regularly. And also in our schools, the children that are coming up, they should be educated that HIV is real. Don't use any sharp object that is not meant for you. Don't take injections where it is not approved. So you must protect yourself and also protect your neighbors, protect your partners. Thank you.
Thank you so much, Dr. Segun.
Thank you very much.
You really broke it down there. One of the things I think you didn't mention is you can also tune into Hude Hour to get awareness when Dr. Segun comes on the program. Thank you so much for coming. Thanks for breaking it down.
Thank you very much.
All right, that's how we round off the program. We have been speaking with Dr. Segun Akindokun. He's a medical doctor and a GMD. And that's how we round off this segment. We'll go on now to our verified voices, where we take a look at what the key stakeholders are saying on this issue. Paul Oladipopo will be joining us after the break. Don't go anywhere. We'll be right back. Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change.
Hey everyone, let's face it, our world today experiences numerous challenges. And guess what? Our community isn't off the hook either. Most of the world issues are either not talked about enough or never talked about at all. But here on Timeline, we've got you covered. we dive deep into issues that affect us every day, leaving behind footprints of wisdom, knowledge, and solutions. Think of it like a roadmap that keeps you on the track for success. So buckle up, because in this new season of Timeline, we're taking another trip through the past, the present, and navigate into a more promising future. Again, we're talking solutions, people. And let's make one thing clear. This is not your average blah, blah, blah convo. This is real talk with a side of inspiration and a sprinkle of wow. I never thought about it like that. I'm your host on this impactful ride. Together, we'll tackle the tough stuff, laugh a little, and find ourselves on the path to positive change. So what are you waiting for? Season 2 of Timeline will be loaded. Let's get started. Hop in and let's drive straight into the heart of issues shaping our world. Let's go. Oh, one more thing. Hit that subscribe button and let's take this ride together.
Welcome back if you're just joining us. This is Verified Voices on Hude Hour, and that means we've been joined by Paul Oladipupo. Paul, what do you have for us today?
I have amazing news for you today, and that is what I'm going to be spreading. Today we're talking about HIV, the prevention, the cure, and also the treatment. It's actually been a lot talking about HIV, talking about where it started from.
You mean potential cure, right?
Exactly, potential
All right,
cure,
all right.
obviously, because back to back, years after years, there have been research back to back on what a possible cure could be. Just before coming on set, I read up on the news about possible research again that is going on about funding that particular research. And I mean, there has been a lot going into the research to get a cure for this particular disease. And hopefully, one day we see the lights and then we'll have a cure finally. But now let's take a look at what we have today on Verified Voices. First on our tweets is from the World Health Organization. They say condom prevents most sexually transmitted disease infections, including HIV. Pre-exposure prophylaxis, that PrEP, prevents HIV but not other sexually transmitted infections. Choose both for maximum protection. And then we have a graphic there saying that condom prevents most sexually transmitted infections, including HIV. PrEP prevents HIV but not all sexually transmitted infections. Choose both for maximum protection. I think I should take the next tweet along as well, so that because they're talking about the same thing, and this is from John Hopkins and Bloomberg School of Health, Public Health. They say PrEP is one of the effective ways to prevent HIV, either as a daily pill or monthly injectable. PrEP can decrease the risk of HIV infections through sex by up to 99%. Talk with your healthcare provider to learn if PrEP is right for you. And then we have an infographic there saying, is PrEP right for me? That's a man, a patient going to an healthcare professional there and asking if PrEP is right for him. And obviously she replies that it is highly effective, is an highly effective tool to prevent HIV infection. The interesting thing about PrEP, right, is the fact that even before you are exposed to it, you can. But the point about it is that if you're staying in a region or you engage in activities where you know that you are prone to get the virus, you are prone to get the virus, what is advisable to do is to take the PrEP. It's more or less like a preventive measure to ensure that you are not exposed to the virus. If you know that probably your work, just like our guest, Dr. Segun, has said earlier on, if you're working in an area where there's HIV, probably you're in a lab scientist, a doctor, or things like that, or where you are living, the area you are living, most people around you are living with HIV. All of those things are things you should check, and then to go to your healthcare provider just to get the PrEP. And there are a lot of things, and also WHO mentioned the fact that condom doesn't, the PrEP doesn't, it doesn't stop other sexually transmitted diseases. And what that simply implies is the fact that for PrEP, its target alone is HIV. And if you are not, if you have, if you are exposed to other STDs and STIs, it doesn't save you from that. That's the point of wearing condom. And also, PrEP in the real sense is 99%, just like John Hopkins have said, meaning that there's still a 1% chance of those that are even still using PrEP getting the infection. That's where condom comes to play that double role now, and that's why the WHO is recommending that you use both. Those that are using the PrEP, you're also using condom if you're engaging in sexual activities.
Yeah, I think some might call that sexual two-factor authentication.
Exactly,
In a manner of
yes.
speaking. But that being said, I think it's also important to note that, like you said, it is for some persons who are more prone. We've heard even right here at Hude Network where some medical professionals have told us that they had to go on PrEP for a period of time after being exposed. So I think these are the issues, and it's, again, another marvel of science that we can take use of, but also to take a warning. That's why I'm very happy with that caveat you give there, so that people don't feel that I am completely invincible now and nothing can happen to me. Is why you should take care on both counts.
Exactly, 1% is still a possibility in the real sense
Very
of things.
rare, but
and unless it's very, very rare, like extremely rare, but 1% can still happen. Let's take the last tweet now before I come to John. This is from Jamaica AIDS Support for Life. It says that every dose of your HIV medication is a step towards a healthier, stronger you staying on treatment, keep your immune system powerful, and help you live well. Hashtag stronger with every dose. Hashtag HIV treatment works. This is what we're saying. You know, it's even those living with HIV, there are drugs for them that can be taken. They are called ARTs, right? That's ARTs. And what this does is to try to reduce the viral load of the HIV, the virus that is in their system. And that's what our doctor has expanded on so much on. Joan and Amadin.
Okay, thank you so much, Paul. It's still what we're talking about. Dr. Segun laid emphasis, and we also read it in the story that there are some people that they will start the dose, and at a point they stop it. So the whole fatigue, they become tired of it and all that. So this particular tweet from Jamaica AIDS Support for Life is saying that every dose is very important. It keeps you stronger. It keeps you healthier, and stronger with every dose. HIV treatment works. So it's very important that we hold it with high esteem and make sure that as someone who is diagnosed with the HIV disease, you should take your medications very serious so that you don't end up affecting your loved ones and people you really, really care about.
Indeed. The way I see it is that the treatment is sort of a way to keep on in the sense that there's a local balance where people say if you give up, you are the one who has, sort of messed up, so to speak. The reason is that you shouldn't, feel as though the journey ahead is tough, because you have to live on medication. Your life could just become a simple one. And in the long run, we've spoken about different research that has going to ensure that this becomes something to the point where it's either cured completely or it is essentially so in reality. So taking your treatment just helps you get to that place where things might be better, and I think you should keep up hope and just continue seeing that there could be a light at the end of the tunnel.
Exactly, true. There's a light at the end of the tunnel. You just have to keep on trusting in that. And I think one thing that we've not even mentioned is the fact that there's a stage where you take your ARTs to, and then the viral load is so low that even the virus is undetectable. And when it's said that if it's undetectable, that means you can't transmit or also infect others with that particular virus. I think that's all we'll be able to take on Verified Voices today. It's been a lovely one. And the news is that it's important for us all to ensure that we're safe, keep ourselves safe. If you feel that you're exposed or you probably might be exposed, take your PrEP, and also don't forget to use condom as well. These are the two advisable ways to try your best not to test positive to the virus in the real sense of things. And until when we're able to get a cure, we'll still continue with research and hope that one day we'll find that light that we're talking about at the end of the tunnel. My name remains Paul, and this is Verified Voices here on Hude Hour. Thank you very much.
Indeed. Thank you so much, Paul. I'd like to add that, abstinence is still a choice. That used to be one of the initial advocacy before progressing to the rest. So it all works in hand. Again, protect yourself across multiple areas. Thanks so much for joining us today. It has been Hude Hour on Hude Network. Do join us once again Wednesday 8 a.m. where we bring to you issues, developments within the humanitarian and development space. I am Amadin Ogbewe. Bye for now.
HIV is not a death sentence. I'm Joan. Thank you so much for joining us. Bye for now.